Storms swept across our community last night, bringing more damaging wind as neighbors and utility crews work to recover from Sunday's severe weather event. Now, I'm grateful to the hardworking line workers and technicians at Nashville Electric Service who have been working round the clock in 14-hour shifts to restore service to Davidson County residents. As of this morning, NES has restored power to approximately 49,000 residents, down from a record high number of 130,000 households that lost power on Sunday evening. Now, 81,000 people are still without power. Now, for your safety, please do not approach damaged power lines or poles and report them to the city by calling 911. I want to welcome back to Costa Jenkins, President and CEO of Nashville Electric Service, who has joined us this morning to provide an update on how NES is responding to the widespread power outages resulting from Sunday's 60 to 80 mile an hour wind. Now, 13 crews from Metro Public Works have been clearing damaged trees and storm debris from Nashville streets and sidewalks since Sunday morning. You can contact Public Works to request debris removal on public rights-of-way by calling 311 or visiting hub.nashville.gov at any time. And I'd like to welcome Mark Sturdivant, Director of Metro Public Works, who is here to discuss the department response in more detail. Now, it grieves me to report 5 Davidson County deaths related to COVID-19 over the past 24 hours. And I want to extend my deepest sympathies to the family and friends of those individuals as they mourn the loss of their loved ones. We must continue to work as a community to slow the spread of the coronavirus. Nashville's Safer at Home order remains in effect as we track the public health benchmarks required to enter phase 1 of our roadmap for reopening Nashville. Please help us further flatten the curve of COVID-19 by staying at home whenever possible and only running essential errands. Now, Public Health Order number 4 is also in place to help move us closer to the beginning of our phased economic reopening. So remember to wear a face covering anytime you're out in public to protect yourself and your loved ones and everyone around you. Remember that a balanced approach and the right public health decisions will help us avoid a false restart of our local economy. Each additional day we maintain our Safer at Home protocols helps to ensure that we do not lose our hard-earned progress. A successful restart depends on a sustained period of economic recovery without interruptions. Now, as a reminder, we've also published several important public health metrics online, which you can view at covid19.nashville.gov. The Metro COVID-19 dashboard includes our coronavirus transmission rate, the 14-day new case trend, our ability to conduct countywide contact tracing investigations, our local COVID-19 testing capacity, and our local hospital capacity. In preparation for Nashville reopening, Metro's community assessment centers are now open 5 days a week, Monday through Friday, from 9 a.m. to 3 p.m. Now, these centers have performed 8,200 tests since March 31st, all free to Nashvillians. The Metro COVID-19 hotline, which was affected by this weekend's storm, is once again fully operational. If you suspect that you may have symptoms of COVID-19, do not hesitate to call the hotline at 615-862-7777 from 7 a.m. to 7 p.m. 7 days a week. Once you call the hotline, you may be directed to a community assessment center to receive further assessment and a COVID-19 test. Remember, all services through the Metro Community Assessment Center, including COVID-19 tests, are free of charge to all Nashville residents. And as always, I urge you to visit Metro's COVID-19 website, where you can contribute to the COVID-19 Response Fund or learn how to obtain direct financial, food, mental health, and social service assistance. I'll now turn it over to Dr. Alex Jahanger, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest on the coronavirus in Davidson County. As the mayor stated, we have had 5 deaths as a result of COVID-19 in the past 24 hours. A 62-year-old woman, a 65-year-old man, a 71-year-old man, a 76-year-old woman, and an 81-year-old man. All of these individuals had underlying health conditions. My sincere sympathies do go out to their families and friends of these individuals. We now have 32 Nashvillians who have died from this virus. Today, we have 3,322 confirmed cases. That is an increase of 131 cases in the last 24 hours. Of these cases, 1,660 are currently active, and 1,630 of residents have recovered and have been cleared. Looking at some of the other metrics we are tracking, the transmission rate continues to be 1 for the week. This means on average, one person who has the virus is passing it on to one other person. Our goal is for this to be at 1. While not where we wanted, the transmission rate is holding steady and not regressing. Testing capacity continues to be improved. Last week, 6,048 individuals in Davidson County were tested. Assessment centers now open 5 days a week. We will continue to increase the testing availability for our residents. And we'll soon have mobile testing teams that will further expand testing. They will activate to test people in areas such as long-term facilities or other areas where clusters may develop, and do pop-up testings in different areas of our city, including neighborhoods that may have a harder time accessing tests. Our public health capacity and the hospital capacity, both regular beds and ICU beds, continue to be in the satisfactory range. Now, we will continue to look at these metrics and other data as we evaluate how well Nashville is doing in fighting this virus. And you can see this dashboard and other data we are going to use on our website, covid19.nashville.gov. Now, as the mayor stated, today our community assessment centers are open and will be open until 3 p.m. The centers are located at Nissan Stadium, Meharry Medical College, and at the old Kmart location in Antioch. The wait has consistently been under 10 minutes, and there have not been long lines. The drive-through facilities will get you assessed and tested quickly, and all at no cost to you. Furthermore, the assessment hotline is back operational this morning, and it's open every day from 7 a.m. to 7 p.m. You can call it at 615-862-7777 and speak with a medical professional. So please get assessed and tested if you think you have the virus. Don't put it off if you're not feeling well. And if you know of someone who you think needs to be tested, please encourage them to call the hotline or go to one of our community assessment centers. We've come a long way in fighting this virus, and we need to remain vigilant. Stay at home unless it's absolutely necessary. If you have to go out, stay apart from others and wear a face covering. This protects you, and it protects others, especially the workers at grocery stores, at the pharmacy, and other essential businesses. These heroes are out there working the front lines for all of us. Please respect and honor their dedication by practicing social distancing and wearing face coverings. Keep it up, Nashville. Every day that we do this, we're closer to when we can open up. Now I'd like to introduce Mr. Mark Sturdivant, Director of Metro Public Works. Thank you.
Hello, everyone. Good morning. I'm Mark Sturdivant, the Director of the Public Works Department. First of all, I want to thank the Mayor for having me here today to speak about the work being done by our department. I also want to take a moment to thank the employees of Public Works. I've never been more proud to lead this department than I have been over the last 2 months. During a time that arguably could be the most challenging time our city has faced in recent memory. So on March 3rd, the Public Works crews began responding to the devastating tornado that swept through North Nashville, East Nashville, Donaldson, and Hermitage, before working its way through the rest of the state. In the aftermath of the storm, our crews worked around the clock to reopen 116 roads and 60 alleys. We restored 72 traffic signals and repaired or replaced 257 stop signs. We coordinated with our contractor to remove nearly 5,900 loads of debris, totaling 306,000 cubic yards from residential curbs and neighborhoods. And we haven't stopped working on that recovery effort since that night a little over 2 months ago, and we won't stop at Public Works until that work is complete. So in the midst of these recovery efforts, we began to learn more about the COVID-19 pandemic. And by mid-March, we were instituting new protocols and procedures to ensure our employees have a safe workplace. We began avoiding gathering groups of employees as well as taking temperatures, rigorously cleaning our vehicles, and ensuring that our crews wear face masks and gloves. We collaborated with our Metro partners to help set up 2 COVID-19 testing sites, setting up tents and signage, and continuing to offer whatever resources we have. And through all of this, our crews also continued trash and recycling pickups, pothole repair, and all the other essential functions of the Public Works Department. Our crews have remained committed to ensuring that the public interest is served, and I, for one, am grateful for their work. And keep in mind also that through all of this, our offices have essentially been closed, and many of our employees are working from home. So 2 nights ago, on Sunday, we were met with another weather challenge, straight-line winds and storms that resulted in 194 roadway obstructions, mostly in the form of trees and debris in the right-of-way. Our crews have been working closely with NES to coordinate power line removal from fallen trees. We can't do our work until they get those lines out. And as of this morning, I think we're down to 27 situations where we're still working with NES to get those lines cleared. We have 15 traffic signals without power. We got 40 of those restored yesterday. And we're optimistic that working with NES will get those back in a timely manner. There's no doubt that the past 2 months, and for that matter, the last 2 days, have been challenging, but the department is extremely grateful for the support of the mayor and of the Metro Council in helping us meet these challenges. We will continue to keep the community updated on our progress, and any residents with questions or requests should reach out to Hub Nashville by calling 311 or visiting hub.nashville.gov. Those are my remarks this morning, and with that, I'd like to introduce DeCosta Jenkins from Nashville Electric Service.
We want to thank the Mayor's Office for supporting NES in our restoration efforts for Greater Nashville. We've made significant progress. We had gotten the number down to 76,000 as of yesterday afternoon. Then the storms rolled in, and then that caused another approximately 15,000 outages. And as of 8 o'clock this morning, we've got the number down to 81,000 people, down from 130 at the storm's peak. I know some of you have gone out to our website and noticed a much larger number, but we're having some technical difficulties with our outage management system. We hope to have that resolved today. One of the questions I'm asked is, why are there no trucks in my neighborhood? And so when we restore power, and the example I gave during the tornado was, I use water as an example. You have the reservoir, and that would be TVA, and the lines coming from the reservoir to the pumping station, that would be our substations. And then the lines coming from out of the pumping stations to the individual homes. And so what we're doing right now is we're restoring power to the pumping stations and to the lines coming out of the pumping stations. So a lot of people have called me asking when their power will be on and complained there hadn't been any people in their neighborhoods. But once we got the substation up, then they had power immediately. And so that's what we're going to be focusing on repairing our primary lines and our substations. Once we get those on, then we'll start looking at the individual circumstances of different customers. We've got all of our crews working 14 hours a day, and they'll be working that 24/7 until this thing is over. We brought in another 90 outside crews, some from Ohio, some from coordinate what we call mutual aid with other utilities, but we're working to get other crews as we speak right now. In terms of some statistics, we've got two 69 kV lines out. We've got 723.9 lines out, 613.8 lines, 19.4 kV lines, and 127 broken poles. For those of you who still don't have power, we understand this is hard for you. And you are our top priority. And we will be working 24/7 until we get everybody restored. Thank you.
Thank you, Mr. Jenkins. Let's start today's Q&A segment. As I announce your name, you may proceed by asking your question over the air. We'll begin with Josh Breslow at WKRN.
Hey, good morning. Thanks so much for taking my question here. My question is for Mayor Cooper. Should we expect to see the Safer at Home order extended now as more information is coming in?
Thank you, Josh. Mayor Cooper.
Well, Josh, good question. We want to withdraw the order and move on to phase one. We're at a delicate place in terms of the advance of the disease in the community, and we are nationally too. There were 25,000 new cases in the country, and you don't want to start too soon. But I'm going to be spending a lot of time with all the public health experts in the next 24 to 48 hours to see how soon it really is prudent to move on into phase one. But let me just spend a moment. Phase one is not the end of social distancing. Phase one is just another phase of social distancing, and we need this week to be prepared for reopening. So I challenge every business to inventory their PPE needs, to think through the safety of their employees and their customers. We will be reopening. The trick is when to do it and how to do it safely. So let's use the time that we have before we reopen to rehearse how to do it carefully. And that's what's going to prevent backsliding. And I encourage every business, we've had some marvelous business representatives here at the podium before, to reach out to the Public Health Department for a consultation and walk through their business as to how to do it safely. We are not interested in businesses being closed. We are interested in people being safe, and use our Public Health Department to do that in the best possible way.
Stephen Elliott at the Nashville scene. Stephen.
Hi, thank you. The governor's office said they would swiftly appeal the Chancery Court's decision, and I just was wondering if you guys are committed to, continuing to fight that up to higher courts.
Thank you, Stephen. Mayor Cooper.
Yeah, I think everybody just expected the chancellor's decision to be round one, and of course, having an appeal, everybody has a principled position. We do feel that the home rule provisions of our state constitution were violated in this particular legislative action, and we and Shelby County have every right to depend on the protections afforded to us by our state constitution. We also particularly do feel that vouchers is poor public policy, and it is not supportive of education or our educators. So, of course, we had no choice. But the way that it was enacted, targeting just two counties for a policy that we're not willing to inflict on the rest of the state, of course, means that you have to go to court and enforce your rights. We are, of course, pleased that the chancellor in round one agreed with us that the home rule protections afforded all counties, including our counties, were violated and how the voucher bill rolled out. But we will see. We're represented by a super great lawyer. I know the state is too. This is why you have courts. Thank you.
Damon Mitchell at WPLN. Damon, you're on the air.
Hi, Chris. This is just a follow-up to the first question. I'm just wondering, like, with the recent spikes, and I know that you all have not set a date, but I'm wondering, like, is a date even being considered at this point, considering the recent spike in cases?
Mayor Cooper.
Well, Damon, thank you. There are spikes and there are spikes. And one of the important metrics from the beginning of this that we've encouraged everybody to look at is time to double. How long does it take to double the number of cases? Is that a week? Are we, to go back to our high school math, is it at a geometric rate, which in fact would begin to overwhelm the community, or is it an increase that is arithmetic and relatively manageable? Though we do have more cases than we would like to have, we're going to have to closely evaluate whether that increase in cases is at a rate that is not sustainable for the community. I think last week I was here and was saying I really wanted to keep these cases to an average of 80 if we could. Well, obviously we've been trending a little bit above 80, but we're not at the 200, 300, 400 that has led to disasters in other cities. And also I want to just share with you something that we all talk about every day that's a little inexplicable, which is the mortality rate. It's tragic. It's tough. It's tough today to announce 5 new fatalities, but I'm telling you, looking at the data, you have to have the conclusion that here we have been spared a much higher fatality rate. For that, we are grateful, but also we need to get to a public health explanation as to can we continue to count on that? And that would be part of the factor in making a decision as well.
Chris Davis at News Channel 5. Chris?
Good morning. A lot of Tennesseans may want to help their neighbors with storm damage. Is it okay for people to get out and help clean up? And are there steps that people can take to help safely clean up the debris but also still flatten the curb?
Meeting May 5, 2020, then handled remotely. This is Debbie Jones, Chair. I'm going to do a roll call of board members. Board Member B.R. Hall, answer present.
Present.
Board Member Stacy Rucker.
Present.
Board Member Chief Henry.
Present.
Board Member Christine Bradley.
Present.
Board Member Shannon Hall.
Present.
Board Member Harold Finch.
Present.
Board Member Tom Curtis.
Present.
Board Member Kevin Crumbo.
Present.
Thank you. As a result of the coronavirus pandemic, the governor issued Executive Order number 16, authorizing boards to meet and conduct their essential business by electronic means if the board determines that meeting electronically is necessary to protect the health, safety, and welfare of Tennesseans in the light of the COVID-19 outbreak. Before
reason that you're not seeing it is because we're becoming effective at social distancing. And as I've said here before, you, the people at home, are going to determine when we can move through our safer at home orders and our restart of the economy orders, because you're going to have to be good at this for a long time. You're going to have masks and distancing and look after your employees and your customers for a long time to come. And it's all something that's going to require practice, reminding, and education to get it right. Particularly Some businesses will be more challenged than others, for sure, but it's something that we can all do. And having an effective social distancing investigation department is also going to be fully challenged. But let's use that as a resource. That is going to teach us where we have failed as a community in protecting particularly our frontline employees, our essential employees, who are not able to distance as well. And where are those outbreaks happening, and why are those outbreaks happening? And let's get to the root of it and apply technique to getting the problem solved.
Nayeli Alamia at 96.7 FM. Nayeli?
Hi, good morning. Local restaurants have looked at the phases to reopen, but some are wondering, will delivering alcohol end in phase one, or up until when will they be able to continue to deliver alcohol? Thank you.
Thank you. Dr. Jahangir?
Yes, as of right now, there's no end date for that service. So until there is, I guess they can continue delivering. Thank you.
Our final question is from Ian Jung at the Tennessean. Ian?
Yeah. Good morning. I wanted to ask, Mayor Cooper had just talked about, some of the spikes in new cases that we've seen, saying that, it could be worse. We're not at the 200 range. There are always going to be, larger numbers than what we're going to potentially to have the larger numbers. What range are we looking at in which we decide, we just cannot open? And I also want to know, are we just further or closer to phase one than we were last week? And with the transmission rate, are we still getting that from Vanderbilt? And if so, how often is that being updated? Thank you.
Thank you, Ian. Dr. Jahangir?
Yeah, thank you so much. Regarding the transmission rate, we are conferring with our colleagues at Vanderbilt weekly. There's also a couple of other in other academic centers that we're working with across state, and that I'm looking at their numbers. To your question of what number is too much, I think it is a multivariable thing that we look at. Time to double, as the mayor had mentioned earlier, is another thing we look at. So the doubling time is how many days does it take to go from, let's say, 500 to 1,000 cases? And if that is around the 13 or greater, so 13, 14, 15-day range, that is as this virus typically has about a 14-day period in which if you get infected, you'll show symptoms in 14 days. The time to doubling of greater than 13 or 14 days is a good sign. Time of doubling of less than that means that perhaps the virus is replicating faster in our community. So that's another thing we look at in addition to raw numbers. But again, our capacity to test as one of the metrics is really important. That's gone up tremendously because we want to be able to quickly identify and block off or any potential hotspots. Our public health capacity, meaning the people who can make the phone calls and tracing, again, that number continues to grow, and we're working to even further strengthen that. So another thing, our ability of our hospitals to take care of patients, not just COVID, but all patients, is an important metric we look at daily. This morning, I believe the number of ICU beds and hospital beds both happen to be 31% for Middle Tennessee available, which is a really good number. So it's multiple variables, and in addition, you look at how much tests one is conducting and compare that to how many positives come out. There's a statistical way one can see if there's a direct correlation with that as well. So multiple variables to consider, but it's just not one. Thank you.
Those are all the media questions in the WebEx queue this morning. I'd like to thank Mark Sturdivant and DeCosta Jenkins for joining us. A recording of today's briefing will be made available later this afternoon. Thank you for joining us. This concludes today's Metro COVID-19 press briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.